Cramps are a common and often painful condition that most people experience at some point in their lives. They can occur in various parts of the body, most typically in the muscles of the legs, feet, and sometimes even the hands or abdomen. The nature of cramps is such that they often strike suddenly, causing sharp, intense pain that can last from a few seconds to several minutes. Once the cramp subsides, the affected muscle may feel tender or sore for a while afterward. The basic cause of a cramp is an involuntary contraction of a muscle that does not relax immediately. This sudden tightening of the muscle is what leads to the pain and discomfort people associate with cramps. While the exact reasons why cramps occur are varied and can sometimes be unclear, there are several well-known factors that contribute to their development. One of the most common causes of muscle cramps is dehydration. When the body loses too much water, whether through sweating, not drinking enough fluids, or due to illness like diarrhea or vomiting, the balance of electrolytes such as potassium, magnesium, sodium, and calcium in the body can be disrupted. These electrolytes are crucial for normal muscle function, and when they are out of balance, muscles are more prone to spasms and cramps. This is why athletes, especially those who train in hot environments, are often advised to stay well hydrated and replenish their electrolytes regularly. Another major cause of cramps is overuse or fatigue of a muscle. When muscles are pushed beyond their usual limits, especially during strenuous exercise, they can become fatigued and more likely to cramp. This is common in people who perform repetitive movements, athletes who do not properly warm up or cool down, or individuals who suddenly engage in intense physical activity after a long period of inactivity. Muscle fatigue leads to an accumulation of waste products like lactic acid in the muscle tissue, which can trigger spasms and cramps. Poor circulation is also a known contributor to muscle cramps. When blood flow to a particular area of the body is restricted, the muscles in that area may not receive enough oxygen and nutrients to function properly. This is why some people experience cramps during long periods of sitting or standing in one position, or during sleep when blood flow may be reduced to the limbs. Medical conditions such as peripheral artery disease can further exacerbate circulation problems and increase the risk of cramps. Nerve compression or irritation is another factor that can lead to cramps. Conditions like a pinched nerve in the spine can cause referred pain and muscle spasms in the legs or arms. Similarly, disorders like sciatica can lead to cramps in the lower limbs due to nerve irritation. In these cases, the cramps are not solely a muscular issue but are linked to the nervous system. Certain medications are also known to increase the likelihood of muscle cramps as a side effect. Diuretics, commonly prescribed for high blood pressure, can lead to the loss of potassium and other vital electrolytes, increasing the risk of cramps. Statins, used to lower cholesterol, have also been associated with muscle pain and cramps in some individuals. Other medications that may contribute include those for asthma, osteoporosis, and birth control. Pregnancy is another period when cramps, especially leg cramps, are commonly experienced. Hormonal changes, weight gain, and increased pressure on the nerves and blood vessels in the lower body all contribute to this. Pregnant women often experience cramps at night, which can be particularly disturbing and lead to disrupted sleep. Nutritional deficiencies play a significant role in muscle health and the occurrence of cramps. Deficiencies in essential minerals like potassium, calcium, and magnesium can impair the normal function of muscles and nerves. Magnesium, in particular, is vital for muscle relaxation, and a lack of it can lead to increased muscle excitability and spasms. Age is also a factor in the frequency and severity of cramps. As people age, the muscles lose some of their mass and elasticity, making them more susceptible to fatigue and cramping. Additionally, older adults are more likely to have underlying health conditions or take medications that contribute to the likelihood of cramps. Although cramps are usually harmless and resolve on their own, the pain they cause can be severe and disruptive. Fortunately, there are several effective treatments and remedies available for managing and preventing cramps. One of the immediate treatments for a cramp is gentle stretching of the affected muscle. For example, if you experience a cramp in your calf, flexing your foot upwards towards your knee can help stretch out the muscle and relieve the spasm. Massage can also be beneficial, as it helps relax the muscle and increase blood flow to the area. Applying heat through a warm towel or heating pad can further aid in relaxing tense muscles, while an ice pack might reduce inflammation if there is lingering pain after the cramp. Hydration is key both as a preventative measure and a treatment during a cramp episode. Drinking water or electrolyte-rich fluids like sports drinks can help restore balance and prevent future cramps. For individuals prone to nighttime cramps, staying hydrated throughout the day is especially important. Improving circulation through gentle exercise, such as walking or swimming, can also help. Regular stretching routines, particularly before bed or after long periods of inactivity, are recommended to keep muscles flexible and less prone to cramping. Activities like yoga and Pilates are particularly beneficial as they focus on muscle flexibility, balance, and controlled breathing. For cramps related to deficiencies, adjusting the diet to include foods rich in potassium, calcium, and magnesium can be highly effective. Bananas, oranges, spinach, yogurt, nuts, and seeds are excellent sources of these nutrients. In some cases, a doctor might recommend supplements if dietary intake is insufficient. Footwear can also influence the frequency of leg and foot cramps. Wearing shoes that provide proper support and cushioning can reduce strain on the muscles and prevent cramps, particularly for people who spend a lot of time on their feet. For those whose cramps are related to underlying medical conditions, addressing the root cause is essential. For example, managing blood sugar levels in diabetics, improving circulation in those with vascular issues, or adjusting medications with the guidance of a healthcare provider can help reduce the occurrence of cramps. In some cases, doctors might prescribe medications specifically to manage cramps. Muscle relaxants can help in severe or chronic cases, though they are typically used sparingly due to potential side effects. Quinine was once commonly prescribed for leg cramps, but due to potential serious side effects, its use is now much more restricted and generally considered only when other treatments have failed. There are also natural remedies and alternative therapies that some people find helpful in managing cramps. Magnesium oil or sprays applied directly to the skin may provide relief for some individuals. Essential oils like lavender or peppermint, known for their muscle-relaxing properties, can be used in massage or baths. Epsom salt baths, rich in magnesium, are another traditional remedy believed to help relax muscles and reduce cramping. Maintaining good sleep posture can also help those who experience cramps at night. Sleeping with a pillow under the knees if lying on the back, or between the knees if lying on the side, can improve circulation and muscle alignment, reducing the likelihood of cramps. Stress management plays a role as well, since stress and anxiety can cause muscles to tense up and increase the risk of spasms. Practices such as mindfulness, deep breathing exercises, meditation, and progressive muscle relaxation techniques can all contribute to overall muscle relaxation and decrease the frequency of cramps. In the case of menstrual cramps, which are a different type of cramp involving the muscles of the uterus, treatments include over-the-counter pain relievers like ibuprofen, heat therapy, and lifestyle adjustments such as regular exercise and stress management techniques. Some women also find relief through dietary adjustments and herbal remedies, although these should be used with caution and ideally under the guidance of a healthcare professional. It's important to recognize when muscle cramps might indicate a more serious underlying health issue. If cramps are frequent, severe, not related to obvious causes like exercise or dehydration, or accompanied by other symptoms like muscle weakness, numbness, or swelling, medical evaluation is advised. Conditions like thyroid disorders, liver disease, kidney disease, or multiple sclerosis can sometimes present with muscle cramps as a symptom. Understanding the wide range of potential causes for cramps helps in choosing the most appropriate treatment and prevention strategy. Whether the solution lies in better hydration, improved nutrition, proper exercise habits, or medical treatment, taking proactive steps can significantly reduce the discomfort and frequency of cramps. People who suffer from frequent cramps should also keep a journal noting the time of occurrence, activities prior to the cramp, hydration status, and diet. This can help identify patterns and triggers, making it easier to address the underlying causes effectively. In conclusion, while cramps are a common and often benign issue, they can cause significant discomfort and impact daily life if not properly managed. By understanding the contributing factors such as dehydration, electrolyte imbalances, overuse, poor circulation, nerve issues, medications, and nutritional deficiencies, individuals can take practical steps to reduce their risk. Treatments range from simple home remedies like stretching and hydration to medical interventions when necessary. Maintaining a healthy lifestyle with balanced nutrition, Regular exercise, adequate hydration, and proper muscle care is key to minimizing the impact of cramps and maintaining overall muscular health.